Hello dears, welcome back to a new video. Today I am going to discuss Pharmacology 2, 5th semester subject. Okay, in that unit 1 we will start to discuss today. Okay, unit first we are discussing the pharmacology of drugs acting on cardiovascular system. Okay, so the cardiovascular system we will represent it as CVS. What? Cardiovascular system will represent it as CVS. Okay, so this cardiovascular system which involves two components, one is heart and one is blood vessel. What? It has two components, one is heart and another one is blood vessels. Okay, so heart work as a pump. Okay, we know which will pump the blood, right? Then blood vessel works as a transport channels. Okay, so it will transport across all the parts and it will means all the tissues, the blood vessel, so it acts as a transport channels. Okay, so this functions of CVS is to supply oxygen and nutrients to all the body tissues and to remove the waste products such as carbon dioxide from the body. Okay, so what is CVS? CVS, we are studying the about heart and blood vessels. So we can tell CVS includes two major components. So the two major components are heart and blood vessels. Heart work as a pump and blood vessels work as a transport channels. So the functions of cardiovascular system is to supply oxygen and nutrients to the all body tissues and to remove the waste products from the body. Okay, so to maintain proper blood circulation, body have to control several factors. Okay, so we have mainly 5 factors the body have to control to maintain the proper blood circulation. So first one is the heart rate. So heart rate means how fast the heart beats, right? So how fast our heart is beating, that we will call it as heart rate. And force of contraction, that means how strongly the heart contracts. Then blood pressure is nothing but pressure of blood on vessel walls. And comes to the blood volume. Blood volume means amount of blood in the body. So vascular resistance, resistance offered by blood vessels to blood flow. Okay, these are the factors which have to maintain to control the proper blood circulation. Okay, so if any of this become abnormal, whether heart rate, okay, or contraction or blood pressure, if anything in this is become abnormal, disease such as hypertension, angina, arrhythmia or heart failure can occur. Okay, so here we will study about pharmacology of drugs acting on CVS. That means the drugs which is related to the cardiac, that means heart and blood vessels, that we will study from the this unit. Okay, first of all you have to remember that CVS drugs are the life-saving medicines. Okay, so we will study one by one category in this unit. Next we will see the next concept, that is hemodynamics. So what is hemodynamics? Hemodynamics is nothing but the study of blood flow and the forces involved in the circulation. So first we will see what is blood pressure. Blood pressure means the force exerted by circulating blood on the arterial walls. That is what blood pressure. So we have two types of blood pressure. One is systolic blood pressure and one is diastolic blood pressure. So when we are talking about the systolic blood pressure, pressure when the heart contracts. So when our heart contracts, the pressure exerting we will call it as systolic blood pressure. Okay. So in the same way, diastolic blood pressure means the pressure when the heart relaxes. So when our heart is relaxing, that time the pressure which we are getting is we will call as diastolic pressure. Okay, these are the two types of blood pressure. Now we'll talk about the cardiac output, that is what CO. So the amount of blood pumped by the heart per minute we will call it as cardiac output. What? Amount of blood pumped by the heart per minute. So we can calculate the cardiac output by heart rate into stroke volume. So the heart rate means what? The heartbeat per minute will call as heart rate. Okay. So stroke volume, that is blood pumped out with each beat. So after getting the stroke volume and heartbeats per minute, we can calculate the cardiac output. Next, when we are talking about the peripheral resistance, so this is the resistance offered by arterioles. What? Arterioles. Arterioles are nothing but small arteries. Okay. So resistance offered by arterioles to blood flow. So if arterioles constrict, we can tell resistance will increases. Thereby blood pressure also will increases. If the arterioles dilate, resistance will decreases. Thereby BP also will decreases. Okay. Next one is venous return. That means amount of blood returning to the heart through veins we will call it as venous return. What? Amount of blood returning to the heart through veins. Okay. So this is the parameter which you have to remember as a basic terms. So hemodynamics means what? Study of blood flow and the forces involved in the circulation. Okay, so this is the important parameter in CVS. Now we will see the importance of hemodynamics. Okay, so the cardiovascular drugs work by modifying hemodynamic parameters. Okay, hemodynamic parameters we have seen now, right? So the cardiovascular drugs which aims to reduce the blood pressure. Okay, if we are taking the cardiovascular drugs, it will help to reduce the blood pressure as well as it will increase the cardiac output when the heart is weak. Okay, so reduce peripheral resistance and improve blood flow to the tissue. So when these conditions are there, we will prefer the cardiac medicines. Okay, so the example is vasodilators. Vasodilators means what? Which will reduce the peripheral resistance. It's like drugs like nitrate, hydralazine are the example. Next, diuretics. Diuretics means what? Which reduce the blood volume. Furosemide is an example. Next, inotropes, which increases the cardiac output by improving the contraction. So digoxin is the example. Okay, this is about the hemodynamics. Now we will see next topic. Electrophysiology. Electrophysiology means heart is beating, right? Heart is beating itself. How it is beating? Actually, heart can't beat itself. Okay, for that we require an electrical stimulation. Okay, so that stimulation will called as electrophysiology. Okay, so heartbeats, how it is happening? A stimulation will send to the muscles to contract. That time we will get the heartbeat. Okay, it's like how our machine is working with a wire, right? We will switch on, it will work. So like that only heart is beating. Okay, so the heart generate and conduct the electrical impulses to maintain the rhythmic beating. Okay, so the cardiac conductive system which is equal to the electric wiring of the heart. So why do we need it? So heart muscles cannot contract on their own. So in that cases, we need an electrical stimulation to make muscle contract. So heart muscles cannot contract on their own. So need an electrical stimulations to start the contraction. Heart beats due to a electrical signal. Okay, so that electrical signal will send to the muscle. So muscle will receive the electrical signal and it will contract, thereby we will get the heartbeat. Okay, this is how the cycle of heartbeat is what taking place. We had seen about conductive system, right? Now we will talk about components of the conductive system. So the first one is the SA node. Okay, so SA node means sinoatrial node. Okay, so this is called as a natural pacemaker. Okay, it is located in the right atrium, or located in the right atrium. It produces the first electrical impulse. So it is responsible to set the heart rate in the range of 60 to 100 beats per minute. So it will spread impulses across both atria, and atria will get contracted. Okay, so SA node is responsible for the speed of heartbeat. So you have to keep in mind, SA node is responsible for the speed of the heartbeat. Next we will see the AV node. AV node is nothing but atrioventricular node. Okay, this is considered as the gateway node. So located between atria and ventricles. So receive the impulses from the SA node and delays it for a moment. So why it is delaying? So that atria empty their blood into ventricles. So before ventricles contract. Next up is bundle of hits. Bundle of hits means a group of specialized flow of fibers which carries us the impulses from the AV node into the ventricles located in the interventricular septum. Okay. Next we have right and left bundle of branches. So bundle of is divided into two. One is right bundle branch and next one left bundle branch. So this carry the impulses from both the ventricles. So it will ensure both ventricles is contracting together. So next one is the package fibers. Okay, these are the fine network of fibers which is throughout the ventriculus. Okay, very fast conducting the fibers. So cause quick and coordinated ventricular contraction. Okay, this is what components of the conductive system. First, it will start from the SA node. Okay, so from here the first impulses will get, then it will go to the AV node. Okay, AV node act as a gateway node. Then it will goes to the bundle of hits. Okay, then right and left ventricles, right and left bundles, then last Purkinje fibers. Okay, this is the components of conductive system. Yes, now we will see the cardiac action potential. Okay, so in the cardiac action potential, the thing you have to remember this cardiac action potential graph. Okay, so this cardiac action potential means sequence of electric changes that occur in heart cell during each heartbeat. Okay, what? Sequence of electrical changes that occur in heart cell during each heartbeat. Okay, it allows the heart to contract and pump blood rhythmically. So it have the 5 phases from 0 to 4. Okay, so this is occurs due to the variations in your sodium. Okay, not variations, changes in sodium, then potassium as well as calcium and chloride. Okay, so movement of this will cause the changes. So the first phase is phase 0, that is called as rapid depolarization state. Okay, 0, it will start from here. So in this, fast sodium channels will open. First sodium channels will get open and the sodium will rushes into the cell. Okay, then cell becomes positively charged. So this rapid upstock of action potential will start the contraction process. Okay, so this is the starting of the muscle contraction. Okay, next one is the phase 1, initial repolarization. So here the sodium channels is closed. The zero phase, the sodium channels will get open, but in the phase 1 the sodium channels will close and potassium ions move slightly out. See, you can see potassium ions move out slightly. Okay, so that will cause a small downward dip in the voltage. So here you can see small downward dip in the voltage. So next one is the phase 2, that is plateau phase. Okay, so this is for the unique cardiac muscle. So here the calcium channels will get opened. Okay, so the calcium will enter and potassium continue to leave. So the calcium entry maintains the contractions and the plateau maintains long contraction. Okay, it will prevent the tetany. Then next phase is the phase 3, that is repolarization. In this stage, calcium channel will close. Here the calcium channel opened, right, in the phase 2. So in the phase 3, the calcium channels is going to close and more potassium ions will get leave and the cells return to its negative charge. Okay, so this is what resting state. We will go for the phase 4, that is resting membrane potential. So in here the cell will remains the minus 90 megavolt and sodium and potassium pump will leak and the channels will maintain the ionic balance. And here in the phase 4, it will get ready for the next action potential. That means it will again start 0, 1, 2, 3, then 4, again 0. This cycle will carry on. This is the sequence of electrical changes that occurs in the heart cell during each heartbeat. Okay, so in each heartbeat we are crossing this 4, that means 5 phases, 0 to 4. Okay, so the fourth one, again it is getting ready for the next action potential. So I hope you people understood. So we will see in the next video. So thank you for watching. Bye bye.